Well, good morning, everyone, and thank you all for tuning in for today's discussion. I'm Congresswoman Lori Trahan, and I couldn't be more thrilled to be hosting this event to talk about the passage of the Inflation Reduction Act and what that means for the costs of life-saving prescription drugs. For those of you who aren't familiar with it, the Inflation Reduction Act is a monumental piece of legislation that will lower costs for families on everything from medications and healthcare to energy bills. It is a big law, and that's why this live stream is the first segment in a larger series that will break down the many ways that families will benefit from the Inflation Reduction Act. But today, we're specifically talking about prescription drug costs. There are a few key ways the Inflation Reduction Act will lower the prices of medications that your doctor prescribes you. The biggest thing we did is finally empower Medicare to negotiate the price of prescription drugs and pass those savings on to Medicare recipients and taxpayers. It's no secret that massive pharmaceutical companies have been jacking up the price of life-saving drugs simply because they can. That's why we as Americans pay 2 to 3 times more for our medications on average than people in other wealthy countries. And for some of the most critical drugs like insulin, it's actually 10 or even 15 times more. This provision will limit that, but we didn't stop there. The legislation caps the out-of-pocket costs for seniors with Medicare coverage at $2,000 each year, saving older Americans hundreds or even thousands of dollars annually. And it even sets the price for insulin at $35 per month for Medicare beneficiaries. It prohibits pharmaceutical companies from price gouging by holding them accountable for price hikes that outpace inflation. And this is something that's really important to a lot of families. The Inflation Reduction Act finally closes the family glitch by ensuring that no family is forced to pay more for health insurance through their employer than they would through the Health Connector. It's not every day that Congress is able to put together a piece of legislation like this, one that puts hardworking people over politics and casts aside the demands of special interests like Big Pharma. These provisions alone are a huge win for Massachusetts families and seniors worried about their next trip to the hospital or to the pharmacy. And I am grateful to be joined this morning by a great guest who is going to help us break down these provisions even more. That guest, of course, is Mike Festa, the State Director for AARP Massachusetts. Since AARP's founding, they have fought for older adults to have access to affordable health care, including prescription drugs, and that's especially true here in the Commonwealth. They've been at it for decades, and I've been honored to work in coordination with them and with Mike since I first got to Congress 3 years ago. Fewer people know what the prescription drug provisions of the Inflation Reduction Act mean for Massachusetts residents than Mike. And I'm so thankful that you're able to be here. Mike, welcome.
Well, thank you very much, Congresswoman. It's really an honor for me to be joining you on this Facebook Live. Let me just start by letting all the folks know that in the 3 years that you've been in the Congress, we've certainly and obviously worked very closely together on a number of issues. And, frankly, one of the key things for us at AARP is, are we able to have access to our leaders? Are we able to work closely in ensuring that there's good information exchange and there's good opportunity to show leadership? And you've been all of that to us. So it's just great to be on this conversation with you. And let's just plunge right in. And I want to let you know that, when you think about it historically, it's been almost 20 years since there was a law put on the books federally that said Medicare couldn't negotiate with Big Pharma over the cost of prescription drugs. And what you said, and what everybody knows that's listening, is the result has been that Big Pharma has taken full advantage and has been able to increase the price of drugs and really put it on the backs of not just Medicare recipients, those in Part D, but just generally the public in the United States. And so the costs that have been borne over the years has had a tremendous negative impact. We applaud Big Pharma. Let me be very clear about this. AARP recognizes, as I know you do, that there is a fundamental value and a critical importance to drug companies being able to do the research and get to market these critical life-saving drugs. But these drugs won't matter if you can't afford them. And so many people are in that place. And I know our membership at Aarp, we hear a lot from our members saying, I go to the pharmacy counter, they give me this copay amount. It's like, there's no way. And last month, it was only half that amount. And 2 years ago, it was a quarter of that amount. So something had to be done. And we worked very closely with you and other members of the Congress to see to it that this law got passed.
That's absolutely right. And I appreciate that partnership. I'd love to launch into a few questions because
Sure.
I think folks who are tuning in, they have specific questions, and there's no better person to help us answer and break it all down than you. So by passing the Inflation Reduction Act, we finally made good, as you said, on our promise to lower the price of prescription drugs for seniors and for millions of Americans worried about being able to pay for their next trip to the pharmacy. Soon, Medicare will start to negotiate prices for the highest demand drugs on the market, drugs that big pharma corporations have used to pad their billion-dollar profits for decades. I know AARP has been calling for this change for a long, long time, and we certainly wouldn't have gotten here without you, Mike. So I'm wondering if you can talk about how important this provision is and how many folks here in the Commonwealth can expect to benefit.
Very good. Well, look, it has to be said from the outset that this is compromise legislation. This is not all of what I believe you, and certainly AARP fought for from the get-go. I mean, we knew that there are a lot of drugs that should be on a list that should be subject to negotiation. But in fact, as a result of this law, we know that the first go-around is going to allow those 10 most popular and most impactful drugs to be determined by our friends in the federal government to negotiate through, with Medicare and Big Pharma, those drugs. But that's not going to kick in also for essentially until 2026. And that's a challenge because it doesn't give us the instant solution to the problem. But what it is going to do, and immediately upon passage, and of course the president has now signed the law, the government will be setting up all of those negotiation preparations and pretty much aligning all of that evidence. So when the negotiations begin, I don't think there'll be any delay whatsoever. But the point is, we start with 10. 2 years after that, it gets to 15. And then it eventually gets to 20 and more. So those common, millions of people affected are going to see over time, real reverberation impact in terms of suppressing the cost of these drugs. It all isn't going to happen now. We really will have to talk about that in this call because there's some confusion about how much of this is now, how much is going to be delayed. But ultimately, we're working with a law which, went through that sausage factory called the Congress, and that it wasn't easy, certainly in working with the Senate as well. So in the end, this is what we have, and there are a lot of good points that you've already pointed out, and we'll go through more detail now.
Yes, I know. Yes, so I agree. It's good to sort of talk about, what folks can expect.
Right.
Both in the short term, but then over a longer term horizon. And I think all of us can agree that, seniors should never have to choose between paying for life-saving medicine or other vital necessities like food or housing, utility bills. For the first time ever, this legislation will cap Medicare Part D out-of-pocket drug spending at $2,000 per year. And this provision alone is estimated to save seniors thousands of dollars annually. Mike, I know AARP has done a lot of research on this issue. You've shared it with us. Can you talk about how much of a game changer this will be for Massachusetts seniors?
Sure. Well, let's put this in context. There are about 1.3 million Medicare Part D drug prescription recipients who exceed the cap. I mean, we're talking about thousands and thousands of dollars that they're paying out of pocket. And so if you take that number of people and you look at what's happening in Massachusetts, we're confident that there'll be tens of thousands of Massachusetts residents who are going to see, because of this cap, a certainty, albeit, let's be clear, $2,000 is not chump change. I mean, that's a lot of money. But now people are paying, thousands and thousands of more than just that cap number. And this is what specifically is being addressed. So the certainty of knowing that once you get to a $2,000 cap, it's not going to be another bill. You're not going to be paying extra for those drugs. That certainty, as well as the cap itself, is going to impact lots of seniors in Massachusetts and, of course, across the country. So it's real dollars and real impact. And frankly, that's going to happen, right around the corner. That's happening in 2023, which is great.
That's right. And so seniors they'll realize that cost savings and that benefit immediately, which I think relieves a lot of anxiety, as you just mentioned. My next question is about one of the most talked about provisions in the Inflation Reduction Act, and that's the $35 a month cap on insulin prices for Medicare beneficiaries. Originally the legislation was written so that every person, whether you have Medicare or private coverage, to have insulin prices capped at that much. But 43 Republicans managed to successfully strip it out of the legislation. And I won't say too much about my reaction to that, other than that this was the only thing big pharma corporations were cheering on with passage of this legislation. But I'm curious what you think of the provision that passed. I mean, capping insulin costs for folks on Medicare, and how important it is that we keep up the fight to extend that cap to every American, regardless of where they get their coverage.
Well, that's the key. It starts with acknowledging that, again, this was a compromise and it was not right, frankly. And Aarp was very adamant about this, as I know you were, and many members of the Congress. Certainly in our delegation in Massachusetts, it was 11 out of 11 were all saying, no way, no how should this insulin cap be limited only to the Medicare population. But in fact, that's the best that could be done, because there was the amendment that took it out, for everyone now, was successful. So in the end, what I would just say is this: let's go with acknowledging that for the millions of people dependent on insulin, that cap of $35 a month is going to have direct and huge impact. No question about it. But to the point you just made, we're not finished with this fight. And frankly, there are going to be other elements of building on the savings of Medicare and building on the reduction of the cost of prescription drugs. There's more to be done. One specific thing that I know that Aarp is going to be doing, and you certainly can appreciate this, is we're going to keep that fight to extend it to everyone who is getting that insulin. And that means the private markets. And there is no reason why good reason anyway, that it didn't happen this go around. But suffice to say, it's right up there as a high priority for continuing to do this battle to ensure that we can have people. Because in the end, I guess, you've made the point, it has to be said, the truth of the matter is that insulin in particular is one of those drugs which, it's been around for 100 years. There's no excuse for being able to charge that kind of money, at least no excuse that's justifiable. They're taking advantage for sure. But the other part of that is how many people who are taking that insulin know if they don't take it, or if they cut down the amount of the insulin they should be taking, this is life-changing or life-threatening. And there's simply there's just no defense to not allowing insulin to be affordable. So we're going to keep that fight up, and we know you're going to be a great ally in making that happen, and hopefully next round will be successful.
That's right. There's always another round.
There always is, yep. Live to fight another day.
That's exactly right. Mike, lastly, the bill does a number of other things to make healthcare more accessible to seniors and other beneficiaries, like establishing $0 copays for vaccines, punishing drug manufacturers for price gouging, and expanding Medicare Part D to provide extra help for premiums and co-payments by increasing the income eligibility to 150% of the federal poverty line. How will these provisions improve the lives of seniors and other Medicare beneficiaries in Massachusetts?
Well, I want to make a point about this. First of all, thank you for explaining those specifics. In Massachusetts, we pride ourselves in being a state with a lot of good things happening, both in terms of the economy and societally, the home care and health care and, all of that. And yet, the AARP and others have seen in their research that 6 out of 10 seniors who live alone are in economic hardship. The amount of money they receive in their mostly fixed income does not meet the costs of living in Massachusetts. So we're dealing with economic insecurity with seniors, which is very significant, even in a state like ours. And of course, part of that's housing costs, right? Part of that is, all the other things that we're very familiar with. So these provisions in particular target lower income seniors and say, 150% of poverty is actually not a big number. I mean, I think it's somewhere around 17,000, but it's because poverty is about 12. So think of it in these terms. The typical senior who's relying only on Social Security as their main source of income in retirement, this is going to impact them. So there are thousands and thousands of folks in Massachusetts, tens of thousands, frankly, who are going to be impacted in the benefit that's going to keep those out-of-pocket costs and the copays to zero, and extending it from 135% to 150 is capturing a lot more seniors who are going to benefit. So,
look, we don't have to emphasize anymore that at this moment, reducing those costs for our families, for our seniors, is so important. Mike, I want to just thank you. I mean, I think we could both talk for hours about the impact of the Inflation Reduction Act and what that impact will have. But I want to be respectful of your schedule. I know we only have you for a short amount of time. And frankly, breaking the parts of the bill down over, a series of small live streams is what we're going to do over the coming weeks. We're extremely grateful for the time you've taken out of your workday to join me in this conversation. I know I speak for everyone tuning in right now when I say how much we appreciate your expertise and your ongoing advocacy. Your support and work for years on this front was key to the passage of this historic legislation. So really, thank you.
Well, back at you. Yeah, and let me just make one quick point. For all of this detail, I know you're going to be, as you say, doing a series of explanations. But for anybody who's interested and you like to use the internet, go to aarp.org. And, type in prescription drugs, and there's just a whole, host of information of detail for those who, frankly, need to know more than what we were able to cover in this short but very helpful and informative conversation. It's an honor for me, Congresswoman. You've been a really great partner with AARP, and we appreciate it. Our members and, frankly, everyone in the Commonwealth recognizes the importance of this kind of leadership, and so thank you.
You bet.
You take care.
And thank you to everyone for tuning in to learn more about this legislation and what it'll mean for our community and for our state. I look forward to keeping all of you updated on the many, many benefits of the Inflation Reduction Act. So thank you all again, and we'll see you next time.